Good afternoon. My name is Kielty, and today I'll be presenting my Health 609 Master of Public Health Practicum entitled Post-COVID-19 Pennsylvania Air National Guard Strategic Public Health Workforce Development and Engagement Initiative. This practicum was completed during the summer of 2025 at the Pennsylvania Air National Guard's 111th Attack Wing Medical Group, and located at Biddle Air National Guard Base, Horsham, Pennsylvania. Over approximately 208 practicum hours, I worked with military and civilian stakeholders to design a scalable model that strengthens both public health workforce development and the National Guard medical readiness through collaborative partnership education and collaborative partnerships, education, and emergency preparedness. This project combined concepts from epidemiology, emergency preparedness, workforce development, health promotion, program planning, implementation, science, and systems thinking in a practical organizational initiative. The COVID-19 pandemic demonstrated that America's public health workforce was not adequately prepared for prolonged emergencies. Although the National Guard played a vital role throughout the pandemic, many Guard members with medical backgrounds were already employed in civilian healthcare capacities and therefore unavailable for military activation. Conversely, many communities lack sufficient numbers of trained emergency medical personnel to respond effectively. The purpose of this practicum was to examine whether the stronger partnership between military organizations and civilian educational institutions could help, as well as volunteer institutions, could help create a larger, more resilient workforce capable of serving both community and national needs. Rather than creating entirely new programs, the initiative focused on integrating existing educational pathways with the National Guard readiness requirements. Several significant issues emerged from COVID-19. First, workforce shortages existed throughout healthcare, emergency medical services, and public health agencies. Second, coordination between military and civilian organizations often occurred only during emergencies rather than through sustained partnerships. Finally, many individuals interested in healthcare careers were unaware of opportunities to simultaneously serve their communities while serving in the National Guard. The concept developed during this practicum is what I refer to as serve your community twice. The philosophy is simple. Individuals can serve their communities once through civilian healthcare careers and second time through military service, or vice versa, creating a dual-purpose public health workforce. The project consisted of 4 primary objectives. First, identify regional workforce shortages and map organizations capable of participation in collaborative training. Second, develop a community medical training framework integrating civilian credentialing with military readiness. Third, develop a community outreach campaign encouraging participation. Finally, design an evaluation framework allowing future leaders to measure program effectiveness and long-term sustainability. These objectives align closely with the HLtH competencies, emphasizing assessment, program planning, coalition building, systems thinking, as well as emergency preparedness. The methodology consisted of 3 major phases. First involved stakeholder mapping. 23 organizations were identified throughout southeastern Pennsylvania. These included hospitals, emergency management services agencies, or emergency medical services agencies, community colleges, emergency management agencies, volunteer organizations, and public health partners. The second phase involved conducting interviews and collaborative meetings to determine organizational interests, workforce shortages, educational capacities, and potential partnership opportunities. The final phase involved synthesizing these findings into an integrated workforce development model supported by measurable evaluation criteria. Throughout the practicum, I maintained a stakeholder engagement database documenting organizational contacts, meeting outcomes, partnership opportunities, and future recommendations. Stakeholder engagement became one of the most valuable aspects of this practicum. Healthcare organizations expressed interest in expanding clinical educational opportunities. Community colleges recognized opportunities aligning educational programs with National Guard career pathways. Emergency medical agencies saw the potential to recruit additional volunteers and certified personnel, as did the National Guard, see an opportunity to liaise with the public and ensure their medical community service needs were met through fresh recruitment, sort of a contraflow of recruiting from the civilian to the military world. Community organizations recognized opportunities to introduce younger populations to careers in healthcare and emergency response as well as the military. And rather than functioning independently, these organizations are all shared overlapping workforce challenges that could potentially be addressed through collaborative planning. So one of the major products developed during this practicum was the proposed dual-track training model. The first pathway focuses on civilian medical education. Participants would pursue certifications such as EMT, basic life support, incident command system training, and eventually additional healthcare credentials. Second pathway consisted of community engagement weekends under the Serve Your Community Twice initiative. These events introduce participants to military medicine, emergency preparedness, disaster response, and career opportunities within the National Guard as well as their civilian community. Together, these pathways increase both community resilience and military readiness without requiring entirely separate education systems or burdening either system, as both could work collaboratively and filling in each other's gaps. No workforce initiative succeeds without effective communication. Therefore, I designed a public outreach campaign emphasizing community service, career development, and emergency preparedness. Materials included a QR code, interest survey, digital flyers, social media graphics, recruitment messaging, community presentations, and then rather than emphasizing military recruitment alone, the messaging focused on improving community resilience while providing education and professional opportunities, both for civilian personnel as well as military people already in the military. This public health communication strategy was designed to reduce barriers to participation and increase community awareness of each other and the ways they could actually serve their communities. One of the most important components of any public health initiative is evaluation. This project incorporated both qualitative and quantitative performance measures. They included pre- and post-training surveys, stakeholder satisfaction, credential completion, participant recruiting, program participation, and long-term organizational partnerships. The evaluation framework also incorporated continuous quality improvement principles. So rather than viewing evaluation as the conclusion of the project, it becomes a continuous cycle of assessment, improvement, implementation, and reassessment. This approach supports sustainable organizational learning and a life cycle for the program that extends beyond the initial phase of the program itself. So as for the results, although the practicum represented an initial planning initiative rather than a fully implemented operational program, several important outcomes were achieved. 23 organizations were identified as potential partners, 7 formal stakeholder meetings were conducted, 74 individuals completed the initial interest survey, demonstrating considerable community interest. Multiple educational institutions expressed willingness to collaborate. A complete workforce development framework was produced. An emergency preparedness evaluation model was created, and finally, all practicum objectives were completed within the 208-hour time frame. Collectively, these deliverables provide a strong foundation for future implementation. As for lessons learned, several important lessons emerged during this project. First, successful workforce development depends more on relationships than on funding. Second, flexibility is essential because military organizations, educational institutions, and Healthcare agencies all operate under different organizational cultures. Third, early stakeholder engagement significantly increases program acceptance. Finally, implementation science reminds us that successful public health programs must be adaptable rather than rigid. One size fits every community, rarely fits every community rather. Instead, scalable frameworks produce more sustainable long-term outcomes for the communities, regardless of the flavor of that community, whether it's military or civilian. So, recommendations for future improvements. Based on the findings of this practicum, I developed several recommendations. Those are to expand formal partnerships between military organizations and civilian educational institutions, as well as civilian emergency management and related medical and public health systems, standardize emergency preparedness education across participating organizations, increase multidisciplinary emergency exercises, develop annual performance metrics to evaluate workforce readiness, both on the civilian and military side, as well as a collaboration or combination of well-coordinated work between the two with significant overlap, continue community outreach efforts emphasizing dual service opportunities, and finally, pilot this model with additional Pennsylvania National Guard units, and eventually expand to other Army and Air National Guard organizations nationwide. So in conclusion, this practicum demonstrated that stronger collaboration between military and civilian organizations has significant potential to improve public health preparedness. Rather than viewing military readiness and public health as separate systems, this project demonstrates that they can reinforce and support one another. The Serve Your Community Twice initiative represents one possible strategy for building a larger, better trained, and more resilient healthcare workforce capable of responding to future emergencies at the state level as well as the national level. Professionally, this practicum strengthened my abilities in system thinking, coalition building, strategic planning, implementation science, stakeholder engagement, and emergency preparedness. Most importantly, it reinforced that sustainable public health solutions are built through partnerships rather than individual organizations working independently in their silos of excellence, as the term is referred to both in the civilian and military world. I want to thank you for your time and attention to this matter as far as the project is concerned, and if there are any follow-up questions, I'll be happy to answer them. Thank you, and have a pleasant day.